The Genex model is based on collecting information, creating new ideas, consulting or collaborating with others, and disseminating the refined results. In this medical scenario, the Genex idea is applied towards treating Dorothy, who's returned from the Emerald City in the Land of Oz with a peculiar medical condition. She's got a severe ruby red rash, and she goes to her doctor, Dr. Pasteur. Dr. Pasteur opens up his medical Genex computer system, and the 4 phases of the Genex model at the upper left: collect, create, consult, and disseminate. The resources he has are personal, hospital-based medicine resources and help desk. He examines Dorothy's medical record using the Lifeline system, which shows information organized by the notes about Dorothy, the hospitalizations, the tests she's had, medications, other information, and immunizations. He sees an important disease, a severe disease of pneumonia, and it did produce a hospitalization. He goes back to those records and examines the x-rays that were taken at the time and the electrocardiogram. He finds everything quite normal, and he proceeds to deal with Dorothy's current complaint, which is the ruby red rash that she shows. This is an unusual condition, but it's giving her a lot of pain and discomfort, and he decides to examine this by consulting his diagnosis reference library. When he selects that, the steps get added to his history on the left side, and on the upper right, the diagnosis reference library appears. It contains many, many medical conditions, and he decides to link the lifelines to the diagnosis reference library and tightly couple by the symptoms in the lifelines to the symptoms in the diagnosis reference library. When he makes that selection, the system search produces as its strongest and most relevant result Munchkin syndrome. Munchkin syndrome is known as MS, also known as Redmond rash. It was discovered in 1982 by Dr. William Gates. The ruby red rash is one of the important symptoms, and disorientation, loss of memory, and other symptoms appear, but the highest one is the high total cell blood count. And so Dr. Pasteur selects that and links back to the lifeline, and sure enough, the recent blood tests do show a high total cell blood count of 81, and also points out the anomaly in Dorothy's blood record that she has a high blood density of 7. He decides to examine the treatments, selects all 4 of them, and does a multiple window open that replaces the current window with the 4 treatment windows: chemotherapy, dialysis, interferon, and surgery. He reads up about each of these and then decides to consult the patient library, which contains 231 million patients, but the Munchkin syndrome patients are a small number, only 4,129, and those that have similar age and genetic background to Dorothy Gale are only 308, and so when he brings them up, he gets this display. And the display uses color coding to show a gender. The female patients are red, the male patients are blue, and he could examine just the male patients or just the female patients, but having the group there seems to be useful. He could look at other parameters of each of the cases and see that there was no particular effect. The body temperature is uniformly distributed, no particular pattern, and weight also would have no particular relationship to the treatments. As he goes to examine the treatments, he looks first at the chemotherapy, and you can see an interesting pattern that only female patients receive the chemotherapy treatment, because it's known to be harmful to males. The dialysis treatment is the most popular one, and we'll return to that shortly. Interferon is only moderately effective, and surgery has a mixed record of some poor outcomes and some good outcomes. So returning to the dialysis, we can see that the points are laid out on the x-axis being the initial total cell count, and you remember Dorothy had 81, so she's in this region here. And the efficacy of the treatment, the reduction produced by the treatment, is on the y-axis. The blood density is shown by size coding, with low blood densities having small dots and high blood density being large dots. We could explore the effect of the treatment on blood density, and you can see with higher blood densities the treatment is much less effective. To confirm that pattern or take a look at it in a different way, we could set blood density on the x-axis, and you can see the strong effect of declining performance of dialysis with high blood density patients. The good news is that Dr. Pasteur is quite knowledgeable about blood chemistries, and particularly blood thinning chemistries, and so he's got an idea. And he decides to accept the dialysis treatment, but he'd like to investigate the possibility of using blood thinning medications. And so he's going to run a medical simulation to test the efficacy of the blood thinning. He believes that 10 milligrams per minute would be an effective dose in this case. He begins the simulation, turns on the dialysis pump, turns on the oxygenation, sets the blood thinner level to 10 milligrams per minute. Then he opens the bypass line and opens valve 1, and he gets his result, turns off the blood thinner, closes the bypass, and he's done with his simulation. The results he got at the upper right do show a good effect of blood thinning, but not sufficient for making the treatment more effective. And so Dr. Pasteur takes the steps of the simulation, he grabs them, and he marks on the blood thinner meter the range from 10 to 100 milligrams per minute, and then he creates a macro, and he runs the macro and gets a very nice distribution that shows the efficacy of blood thinner is best at the 50 milligram per minute rate. So now he's got a plan, and he can take the original treatment template for dialysis, create a modified version of dialysis with blood thinner, and includes his name, Dr. Pasteur, as the modifier of this treatment template. He then does a multiple select and close for the other windows and makes this his plan for treatment for Dorothy. However, he notices that Dr. Lyon is the inventor, and Dr. Lyon was a good friend of his way back in medical school. And so he decides maybe he'll consult with Dr. Lyon. He selects Dr. Lyon's name. He goes to his message resources and pastes Dr. Lyon's name in a message and types, "I have created a new dialysis treatment for Munchkin syndrome. Please consult." He goes to the history on the upper left and selects all the activities, the lifelines, the diagnosis reference, the patient library, the simulation, and the treatment templates, and all his decision making is pasted into the message, and then he's ready to send that message off to Dr. Lyon. A few hours later, he gets a response from Dr. Lyon from the University of Courage, Department of Medicine, and Dr. Lyon's message for the record is, "I agree with your assessment of 50 milligrams per minute." They have a little chat and discuss old times, review the simulation results, and discuss the case. Dr. Lyon has some concerns about the treatment, but he's interested, and he pastes his name into the patient record, registering himself as a consulting physician on this case. They sign off and ready to move on. and Dorothy goes for her treatment plan at the hospital, which turns out to be a good success story, and she recovers and her ruby red rash disappears. Dr. Pasteur is very pleased that his improved treatment plan has worked out, and he adds his treatment plan to the diagnosis reference library, and that becomes an improved treatment procedure. And he writes a message: I have developed a new dialysis treatment for Munchkin syndrome. You may be interested in looking at this case since you are working on a similar case. And he goes back to the patient library, and he grabs the cases in which a patient had high blood density, and he puts those into the message and extracts the doctor's name so that all the physicians treating similar cases will receive this message. He drags in the dialysis treatment plan, and he's got his message composed, and he sends the message. He then turns to write an article for the New England Cyber Journal of Medicine on the treatment of Munchkin syndrome by dialysis with blood thinning, and prepares the results for submitting to publication. And that's the end of this Genex scenario.